who have insurance, except the insurance company won't pay for anything, so it really doesn't help you to have much insurance. You know, let me ask you, how many of you know somebody who's uninsured? Wow. And how many of you know somebody, maybe you yourself, with insurance, except you can't get the insurance company to pay your doctor or your hospital bills? You see, we've got two big problems. We talk a lot about the uninsured, but I bet at any time during the year, there's another 30, 40, 50 million people who are fighting with their insurance company, or their doctor's fighting with their insurance company, or the hospital is fighting with their insurance company. So here's what I think we should do. If you have health insurance and you're happy with it, which a lot of people are, then nothing changes. You keep what you've got. But if you are uninsured or you are underinsured, we're going to open up the Congressional Health Plan so that everybody can participate in the plan that you help pay for. You know, Congress has a good plan for itself. Takes care of members of Congress, their staffs, federal employees. It's got about 250 private insurance options. On average, they're less costly than you can find through your employer or in the private marketplace. And those plans are good plans. They cover mental health, which we need to cover. They cover prevention, which we need to cover. And if you look at how they're paid for, members of Congress pay 25% of the cost, and taxpayers pay 75% of the cost. So I figure if it's good enough for Congress, it is good enough for the American people. And we will provide health care tax credits to people who can't afford it on their own. We'll limit the amount of money that anybody ever has to pay as a premium to the insurance company as a small percentage of their income. We're going to regulate the insurance companies differently because they're no longer going to be able to discriminate against people and eliminate coverage for your pre-existing conditions. And they're going to have to save money by investing in prevention over the long term. And if we do this, we can cover everybody and lower costs for everybody as well, because once everyone is in the system, then people will be able to pay earlier for the kind of preventive care that they need instead of showing up at the emergency room when they're already so much sicker and their problems are so much more expensive. So those of you who are nurses and doctors and healthcare professionals, you understand this completely. Now, this is a big difference between my opponent and me, because I believe so strongly that we have to provide quality, affordable health care to everyone. And he has presented a plan that doesn't do that. Now, I understand that it is hard to take on the insurance companies. Remember, I've done that. I know that it's hard. I think one of the reasons why we will be successful this time is that I learned a lot about how you are able to take them on and win. And we're going to have a coalition of business and labor, of doctors and nurses and hospital administrators and healthcare professionals that will be able to withstand all of the pressures of these special interests. But I think if you give up on universal health care, you're giving up on a core democratic and American value. And I reject the idea that we cannot achieve universal health care. It is worth fighting for, and I intend to go into the elections standing for and fighting for universal health care. I'm going to make it happen this time with your help. Now, we also have to do something about education, and I think we've got to start earlier with preschool education, helping parents help their own kids. I'd like to see us move toward a universal pre-kindergarten program for 4-year-olds to get them better prepared so that they can compete. This is especially important in communities that have, kids who are poor. Let's just face it, kids who are poor enter school behind and rarely catch up. If we spent those 5 years helping them be better prepared, we would save a lot of money on the other end. We would save money from school dropouts and school failures, from prison costs, from unemployment. And the research is totally convincing that the better prepared we help make a child by the age of 5, the more likely that child will be a productive and successful citizen. And it's better to put $1 in during those years than $7, which is the comparison on the other side. So I want to do more to invest in early childhood education. And I want to end the unfunded mandate known as No Child Left Behind. I don't think that's the smartest strategy. I want to, as president, start talking to our educators again and actually listening to our educators about what works and what doesn't work in our classrooms and our schools. I don't think we should turn all our children into little test takers and our teachers into big test givers. I don't think that's the best way to get accountable educational outcomes. And I want to make college affordable again, something that it hasn't been for a long time. Now, how do we do that? Well, we get back to doing what we did, when I went to school a long time ago. I got to borrow money directly from the federal government at about 2% interest. And that's not the kind of rate you can get anymore today, is it? But it was an investment. It was an investment that our country made in those of us who went to school, and then we paid it back. And that's what we should be doing. So here's what I will do to make college more affordable. I want to give $3,500 tax credits to families so you can use your own money more efficiently every year for your child. I want to give Pell Grants much more buying power, link them to the increasing cost of tuition, and make them go year-round, which is something we're working on to make happen. We want to get the student loan industry and all their predatory lending practices out of your lives and out of your way. You know, I've been doing a little experiment as I travel around the country, and I ask students when I go to college campuses, what's the highest rate of interest that anybody's paying? And so, you know, when I started off, people were yelling out 12%, 15, 18. Well, the other day in Minnesota, it was 27%. There is no reason for this to continue. People cannot afford this. It stops them from going to college, or they graduate with so much debt that they don't know how they'll ever pay it back. So I want to get back to direct lending, which is a lot cheaper, and we can have a revolving fund, so as students pay it back, more students can participate. I want to give 2 years of national service to those who need to earn money to go to college, so that you can, if you come from a family of modest means, you can work 2 years and you can pay it back by actually going to college and making a contribution. If you graduate with debt, as so many people do, if you're willing to go into a public service job like nursing or teaching or law enforcement, we will let you pay off your debt over a number of years so that you, too, can get a good return on your investment. Going to college should be something we encourage, not discourage. But let's not only think about the kids who go to college, because most young people don't go to college. And what are we going to do for all the young men and women who build the buildings that we live and work in and do a lot of the other hard work that keeps our economy and country going? I think we need more job training, more apprenticeship programs, more help for community colleges. Anybody willing to work hard for a living in America should have a good standard of living with a middle-class standard of life. And I know that we can make this happen again, because one of our goals has to be to rebuild a strong and prosperous middle class. Do you need some water there? Would you mind? Here. Okay. I think somebody got a little faint. Here's some water.